And I appreciate you joining us. With this, okay. I've been in Raleigh since 1991. This practice I established in 2002. I am a fellowship trained cornea specialist, which means I also do corneal transplants and treat corneal diseases. But I've done LASIK since 1996, and I'm going to tell you a little bit about LASIK, why have LASIK, who has had it or should have it, and where to have it. So first of all, why have LASIK? First of all, when you walk out the door, you want to be able to do that without worrying about having your contacts, or if you're traveling, your solutions, or do whatever you do without thinking about having appliances to help you with your vision. So you want to be able to see to do what you want to do without thinking about it. You want to be able to see to do what you like to do without thinking about it. So I think that that's a compelling reason. Of course, the first thing people think about, well, is it safe? Because, of course, you can go online and see all kinds of horror stories, but those are kind of biased. Safety is number one, and one thing you have to remember that the alternatives to LASIK and other laser correction, extremely safe. In fact, several years ago, there was a study that showed that the contact lens complications, especially with overnight contact lens wear, may be actually greater than LASIK. Now, that study was done in several studies since 2005, but the contact lenses have also gotten a lot better. So I have to say that the safety issue, contact lenses being more dangerous than LASIK, maybe not a fair comparison now, but the LASIK complications are extremely low, and with the current technology, extremely safe. The other thing is, you can make a case, a financial case, for doing refractive surgery. If you look at the cost of what it takes to wear contacts, go for the visits, get measured, buy the contacts, a back of the envelope estimation, you could be ahead of the game in 7 years, and that's with a certain set of assumptions. But with contact lenses, you could certainly make the case for it. With glasses, assuming someone buys 15 pairs of glasses throughout their lifetime, it would take longer to come out ahead with LASIK versus glasses, but you could still make the case. And of course, there's the lifestyle issues. So money isn't everything, but it's not inconsiderable. Who has had LASIK? Well, it's estimated that about 30 million people or so worldwide have had LASIK since the early 1990s. In the U.S., it's probably on the counting, and there are a lot of people that are eligible for LASIK. When I say LASIK, I mean other forms of laser vision correction. You should be less than 60 years old or thereabouts, and the reason 60 is not hard and fast is that other things tend to affect vision, like early cataract formation, that may also change your glasses prescription, and therefore what is lasered into the cornea may not be a stable correction as you get older. So I look skeptically on someone 55, 60 years old unless it's absolutely great-looking lens and they're correctable to 20/20 vision. Who else might have LASIK? You should be over 18 years old because you want that correction to be stable. It's FDA approved for people over 21 years old, but mature kids who are 18, 19, 20 years old who know what they're doing, stable correction, they've been done absolutely terrific with refractive surgery. And when I say refractive surgery, I mean surgery that's needed to correct what glasses can correct. Of course, your glasses need to be stable. I want to see a correction in your glasses or contacts that 1 year old at least, where it hasn't shown much change at all, usually plus or minus a half a diopter of sphere and up to 1 diopter, well, 1 diopter astigmatism. But, you know, we've got to look at it different ways. And there are many, many measurements that are done before we make a determination that that is stable. There are other things that we look for in the screening examination for laser vision correction. This is an extreme example, but you get the point. Cataract, the lens of these is a whitish-looking cataract seen through the pupil. Even subtle degree of cataract can cause a shift in the glasses that you need up front, and we don't want a shifting correction because then you're not going to get the longevity that you deserve from this correction. So during the screening, we're looking for all kinds of diseases in the retina in the back of the eye, in the cataract right behind the iris, and also in the cornea. One of the things that you worry about in the cornea, for example, is a condition called keratoconus. Now this may first be obvious to the person in their 20s or 30s, and it may come on after someone's had LASIK. So some of the testing that's done in the preoperative workup is specifically designed to detect this even at the very earliest stages. Because theoretically, if you thin down the cornea by sculpting that surface tissue, which you see bulging out there a little bit, theoretically you can tip someone over into frank keratoconus if they have that tendency. There's also a condition called ectasia that you might have read about, where it's a keratoconus type condition where that cornea bulges more and more forward as the years go on as a result of LASIK. So there's guidelines that many people have put out there to try to avoid the situation where you tip that person into ectasia or frank keratoconus with the laser surgery. Fortunately, that's rare, and there's some newer treatments for that that look very, very promising. But you specifically screen for keratoconus or someone who might be at risk for ectasia before surgery. Another thing that you want to be very careful about is any external disease, and by that I mean any condition of the eyelashes or the eyelids or the conjunctiva that may indicate that healing might be prolonged or difficult. We definitely want to stack the deck in our favor, and a person who is a subspecialist in cornea and external disease is exactly the person that can do that. So again, preoperative examination is critical, and we do not charge anything for this examination. We can tell pretty quickly if you're a good candidate. So not to belabor that, but the screening test is a great deal, and it tells us a lot about you just at that first meeting. One other thing I want to mention that's important. During this free examination, we take particular care to look for what's called dry eye. A lot of people have heard that dry eye is a real problem. It should be corrected before refractive surgery, that is LASIK, and it becomes more of a problem after refractive surgery. With the current ways that are done with the LASIK, the thin flap LASIK, you are severing the corneal nerves at a level of about 50 microns into the cornea. These nerves are critical for the tear film to function. Similarly, if you stay on the surface and don't make a deeper flap, as with refractive surgery called PRK, photorefractive keratectomy, the nerves are still impacted. These can lead to dry eye, but it's transient. And it's important to support the person through this period of 60 to 90 days after surgery. It is extremely unusual in my hands to have dry eye be a long-term problem. If it is, then this person probably has some other things going on, like allergy, that still need treatment. It's important to address this preoperatively to optimize healing. But again, in my experience, it's extremely rare to have someone with long-term dry eye as a result of refractive surgery, the way that it's done now. So I want to put that one to rest. There are ways to treat it, and again, a cornea subspecialist is just the person you might want to look for to address these issues, especially before surgery. So come in for your free screening. I think it's extremely important to, as I say, stack the deck in our favor with that free examination. Where should you have it? We're right here in Raleigh, have been since '91. I've been doing LASIK since '96. I'm a cornea specially trained surgeon. I have about 20,000 refractive procedures I was also medical director at LASIK Plus for several years, and that was a lot of fun, and we got great results there. Our retreat rate is less than 5%. Greater or equal to 20/20 vision. Last time I looked, 89% for LASIK and 92% for PRK. We would stack our results up with anybody locally or nationally. Another thing that the FDA looked at was loss of vision, 2 lines or more. I think that's a very loose criteria. I cannot recall ever having a patient that lost best corrected vision. Again, we'll stack up the results against anybody. Our technology, I think, is also the best combination on the market. For LASIK, you need 2 lasers, and I only do all laser LASIK. I do not use a blade. One is called the Zemer femtosecond laser, used to create the flap. And let's look at a video of that real quick. We're going to go ahead and start this video, and I'll tell you what you're seeing here. So the femtosecond laser uses a series of cavitation bubbles. Think of them as tiny perforations like a postage stamp. And this creates an incredibly precise layer of the cornea just under the surface layer that you see up top there into what's called the stroma right below it. And typically I go 110 microns. You cannot do this precisely and safely with a blade. Also, the laser I like makes the smaller bubbles that you see on the right, not the larger ones to the left. There's a lot less energy put into the eye, and people are a lot more comfortable right after surgery. So with this layer created, then all you have to do is outline it and gently lift it up, revealing what's called the stroma underneath. And then after that, the laser is applied. This laser that's used in the second case is called the Allegretto. The Allegretto is, I think, still the best laser available in the U.S. is incredibly fast. And the second laser is used once that flap is lifted to sculpt underneath the flap. Now this is a scanning or a flying spot laser, not the circle that you saw in the last one, and it goes at 200 hertz, and once it's done, that flap is put back into position. That's LASIK, laser in situ keratomileusis. We also do a lot of a procedure called PRK, photorefractive keratectomy. The way that this differs from LASIK is alcohol is applied to the surface of the eye. And although I like these cool graphics, we don't do it this way. We put a sponge soaked with alcohol to soften the surface cells and just remove them. And once those cells are out of the way, the stroma is exposed, and that same flying spot laser is used to do that sculpting, which is incredibly precise. And instead of the flap being put back, there's a bandage or splint contact lens that's put over the eye to protect it as those cells heal back, typically within 4 days. The difference between PRK and LASIK, PRK takes a little bit longer to heal. People are somewhat more uncomfortable, although I think we have an excellent drug regimen to get them through that. The LASIK is very convenient, but some people do not want that flap in the stroma, and that is permanent. They're surprised to hear that. That being said, the LASIK flap rarely slips. Very, very few complications associated with the laser-created flap. I think the two procedures are very, very equivalent, and most people could choose between them, and sometimes it does come down to cost. So that's a brief overview of what we do here at Triangle Eye Physicians. Little bit of information about why you might consider LASIK, who can have LASIK, who shouldn't have LASIK or PRK, and of course naturally where to have it. So please feel free to send us some questions if you like. Look at our website, www.triangleeye.com, or eyecare@triangleeye.com. And we'd love to get in touch with you. Or come on in for a free visit. We'd love to see you and let you know whether or not this is something that would be a good idea for you. Thanks very much for hanging out with us today.